TRT and Hormone Optimization group. Hope y'all are doing well. Today I want to talk about naltrexone, namely what we refer to as LDN or low dose naltrexone, and the implications that it can be used in treating Hashimoto's, which is an autoimmune thyroid disorder. So naltrexone is known as an opioid receptor antagonist. Historically, it's been used to help patients who have opioid addiction and or alcohol addiction to maintain sobriety. So it works by binding the opioid receptors as a pure antagonist, and by pure antagonist, I mean that it binds a receptor, but it doesn't have agonizing effects on it. It's purely a opioid receptor blocking agent. It's also actually been used as a weight loss drug as well. That brand name drug is called Qsymia, and it's naltrexone combined with phentermine. But we're not here to talk about naltrexone being used in one's opioid and or alcohol sobriety program. We're here to talk about how it can be applied to the Hashimoto's patient. So for patients that do suffer from Hashimoto's, which is an autoimmune disease, naltrexone can be used to help mitigate the effects of the thyroid antibodies. It can also be used to help keep the thyroid antibody levels lower as well as mitigating some of the long-term effects of Hashimoto's. I've used it also in patients with Lyme disease. I've also used it in patients with fibromyalgia, but regardless of their underlying etiology regardless of the underlying diagnosis, the mechanism of action still remains the same. And that's because naltrexone can help augment their immune system. So low-dose naltrexone works by upregulating what's called opioid growth factor. From this point forward, I'll refer to opioid growth factor as OGF. So it also upregulates your endorphins, aka your endogenous morphine, and it can enhance cellular growth mechanisms as well. When naltrexone is introduced to the body, it binds OGF receptors. Meanwhile, it also displaces OGF from the receptors that they're bound to. What this does is this leads to more freed up opioid growth factor, once again, aka OGF. But since now you've freed up more OGF, there is more OGF readily available to bind receptors, and therefore your body will then upregulate even more OGF receptors. And this is like a cyclical cascade. And again, this will augment your immune system and it'll enhance cellular growth mechanisms as well. When using naltrexone to treat a patient with an autoimmune disease, in this case Hashimoto's, we use low-dose naltrexone, hence the acronym LDN. And those doses typically range from roughly 5 milligrams and less than that. Some patients start on 2, some start on 3, some get to 4.5 or maybe 5. Now, treating opioid sobriety and or alcohol sobriety, those doses tend to stay at roughly 50 milligrams once a day. So have you ever heard of, I'm sure you have, the phrase a quote-unquote a runner's high? Well, that's essentially endogenous endorphins being released, which endogenous endorphins are essentially opioids. They're endogenously produced opioids. The word endorphin actually comes from the combination of two words, which is the first word is endogenous and the second word is morphine. Combined, they come up with the word endorphin. So I get asked this question a lot. So if a low dose of naltrexone can augment your immune system and your health, then wouldn't a higher dose of opioids be even better? The answer is no. So naltrexone does have a really short half-life, roughly 4 to 5 hours. And this works in a process that we can refer to as a quote-unquote a rebound effect. Now, I just mentioned that naltrexone binds the OGF receptor, displaces it, the body senses more displaced OGF, and then upregulates more receptors to bind that newly displaced OGF. That's a rebound. So if you have a higher dose of naltrexone, it's going to extensively saturate the receptors to the point to where this freeing up, upregulating, binding, unbinding process doesn't occur. That's why we use a lower dose of naltrexone, just enough to upregulate a little bit, free up, upregulate, bind, rinse and repeat. Appreciate y'all tuning in today. Hope you found this video helpful, and keep tuning in. We'll see you next time. Thanks.